Hi, I'm Dinushika Mohottige, and I am a general nephrologist and assistant professor at the Icahn School of Medicine at Mount Sinai. And I have appointments in the Institute for Health Equity Research and in the Dr. Barbara T. Murphy Division of Nephrology. It's really a pleasure to be here with you all today. The key causes of kidney disease in the United States are high blood pressure or hypertension and diabetes. And it's really important to recognize that these two factors are the most common causes of kidney disease because both of them are things that we ideally can intervene on and prevent. Some of the most important things that individuals can do in terms of preventing kidney disease from occurring is speaking with a primary care physician or whomever you see for your primary care needs about whether you have any of these common risk factors and then addressing them at home, either through medications or changes in the way that you are living your life, thinking about things like diet and the role of certain types of foods that might influence, again, both diabetes and hypertension. Secondarily, thinking about your physical activity, and this doesn't have to mean going to a gym, but really even fairly vigorous walking can be incredibly important. Thinking about opportunities to make sure that you're eating foods that you like, but that are not necessarily going to accelerate the risk of kidney disease is important. And the National Kidney Foundation and other patient-facing organizations have a lot of resources on how one might do this. And then third, I think it's really important to recognize whether you yourself have a family history of kidney disease. So have other people in your life been impacted by kidney disease? Have they been on dialysis? These are some important things that you might want to know before having a conversation with your provider or healthcare team about your own risk for kidney disease. One of the toughest things about handling or managing kidney disease is that kidney disease often presents silently. And although there are about 37 million people in the United States who are living with chronic kidney disease, less than 10% actually in many studies have been found to know that they actually have kidney disease. And that is because the symptoms of kidney failure are often silent until a person has already lost a substantial amount of their kidney function. And this is really, really important. So one of the things that you can do is first have a conversation with your physician or healthcare provider regarding what your kidney function is. That can be measured in blood tests, including the serum creatinine, and that can be assessed also by looking at your urine to see whether you are having an abnormal amount of protein spilling from your urine or whether you have red blood cells, which shouldn't be in your urine, coming through your urine. There are also a few symptoms that you might be thinking about in the context of kidney disease. This can include just being more fatigued and having less energy, having a harder time concentrating or doing the things you typically do. This can also include difficulty sleeping. This can include changes in your urination. So noticing having less urination, urinating more often, seeing blood in your urine is an incredibly concerning finding, as is noticing foamy urine. Other symptoms person who has pretty advanced kidney disease might begin to experience is swelling around the feet and the ankles, cramping in your muscles, having a poor appetite overall or feeling less inclined to eat, having swelling in other parts of the body, including around the eyes, or having changes in your skin, drier skin or itchy skin. Each of these might represent some symptoms that your kidney function has decreased and you might need to see a physician soon. Fortunately, due to the efforts of the kidney care community broadly, there have been multiple advancements in the treatment and management of kidney disease in the United States. I first want to highlight that there's an important deliberation occurring now, which is regarding whether kidney function should be assessed as a preventative screening opportunity by the U.S. Preventative Service Task Force. And there are many kidney care organizations that are advocating for this. And this would mean sort of a more universal opportunity to screen people for kidney disease, detect it earlier, and therefore intervene earlier. The second important point to make is that in the last several years, we have seen, fortunately, the opportunity to really intervene upon and reduce the risk of kidney disease among individuals because of multiple classes of new therapeutics. One of the most important is called SGLT2 inhibitors. These medications can now be used in individuals with and without diabetes to slow the progression of kidney disease. Along with this, there are several new agents, including GLP-1 agonists, which are used to treat diabetes and other conditions, which have important effects in terms of reducing the risk of kidney disease progression and poor heart-related outcomes, which are often linked to having kidney disease. These are just two examples of the types of disease-modifying therapies that have really given us opportunities to slow disease progression, particularly among people who have diabetes-related kidney disease, but also in individuals who do not. I think it's really important for us to think about kidney disease as one of the many things in a person's life that might impact how they feel, how well they're doing, and what risks they have for other diseases and concerns, particularly those impacting the heart. I think that for me, one of the most moving things is always hearing from the people that I am fortunate to take care of about how their kidney disease has impacted them. And, you know, I just mentioned there are all of these symptoms from sleep to appetite to swelling and fatigue that are influenced by kidney disease. One of the, I think, important things this month, March, is Kidney Health Month, is to really raise awareness about the fact that even though we often don't think about them as being so relevant to the way that we feel, kidneys are doing a lot of work for us. And that's why people who have pretty advanced kidney disease describe such difficult symptoms. Again, as mentioned, from sleep to fatigue, the ability to exercise, et cetera. When individuals reach the stage where there is kidney failure, and they require some replacement of their kidney function that's not in the form of a transplant. For example, dialysis. Many people describe a lot of challenging symptoms with dialysis. Even though it is a life-saving therapy, it often comes with the burden of having to undergo this treatment several hours per day, several times a week, 3 times a week often. And although there's opportunities to do this therapy at home, it still comes for many patients with additional symptoms, again, feeling fatigued after the treatment, having less time to spend with family, and in some instances can have influences on mental health as well. So depression and anxiety, we know the burden of both of those issues are higher among people, particularly who have kidney failure. So there are, again, many types of symptoms, both physical and in terms of mental health, that unfortunately can arise due to kidney disease. And so it's really important to feel empowered to speak with your healthcare team early and often about whether you have kidney disease. If you have kidney disease, to identify the causes of that early and then to intervene early, and so that we can really prevent people from getting to that stage of kidney failure and needing this kidney replacement therapy. I think the biggest advice that I have for people at risk for kidney disease, so people who have high blood pressure or diabetes, is to really start to have a conversation with your healthcare team and healthcare providers about what things you can do to manage that risk or control those conditions on your own, and then ask them for help, right? Leaning on them as a team to identify the medications that can help slow disease risk or reduce your risk of actually developing kidney disease. And then to identify resources in the community that can help talk to you about social support and other things that you might want to know about kidney disease. Again, the National Kidney Foundation is an amazing resource, and there are several other resources for people living with kidney disease in the United States that offer everything from educational materials about what kidney disease is and how it might influence your life, to the types of foods that you might be wanting to cook that are more kidney friendly, to resources and support as you transition into perhaps needing dialysis or thinking about a transplant. For people who are already living with kidney disease, I think one of the most important things is to feel empowered to remember that you know your body better than anybody else. And so if something is not feeling right, or you're concerned about a rapid change in your kidney function, engage with your healthcare team and ask for the answers that you deserve about what is going on. I think the second thing for people who are living with kidney disease is to remember that there are multiple options, particularly once you get to the stage of having kidney failure or requiring kidney replacement therapy. There are multiple options that your providers and your healthcare team should be speaking to you about. So dialysis is not the only solution. Some individuals have to be on dialysis, right, for a certain amount of time. Other individuals might want to hear about conservative options for care. And transplantation continues to be the ideal option for the treatment of kidney failure. But getting a transplant is a long process that requires, many, many steps. And so asking about transplantation early and often from your healthcare team is really, really important. Having a person with you at your visits to take in some of the information about what your options are, what treatments look like, is also really important to help navigate such a complex and challenging process. We healthcare providers are here for you and here to partner with you in making those decisions so that they are ideally in line with your goals and values. And so remembering that is essential as well.